Hi, today's lecture is about dental consideration for patients with a neurological disorder. Our first part would deal with the patients having epilepsy. So what is epilepsy? Epilepsy is a group of disorders characterized by recurrent changing in the neurological function. And this can be accompanied by altered consciousness or involuntary movements. This is all occurred due to abnormal electrical activity within the brain. We have different types of epilepsy. We have the generalized epilepsy and partial seizures. Generalized involves most of the brain, while partials involves a specific part of the brain. Generalized can be further classified into either tonic-clonic, okay, or absence seizures. Tonic-clonic is the most common types of seizures, and this is what we are going to discuss about. Absence seizures is just brief periods of unresponsiveness, that might be about 30 seconds. Partial seizures can be further classified into either simple or complex. Simple, where the consciousness of the patient is still preserved, while the complex partial seizures, where the consciousness is a patient become unconscious. We have also status epilepticus, which is a complication of epilepsy. The most one is the complication of tonic-clonic. A status epilepticus occurs when there is either a prolonged seizure that continues for more than 5 minutes, or it's become recurrent. Okay, so frequently occurring seizures from one after another. Status epilepticus can result in respiratory compromise with resultant hypoxia, acidosis, and might give risk for brain damage or even death. What are the general signs and symptoms of patients with epilepsy? Okay. Extraorally, for patients having epilepsy during the seizures, generalized tonic-clonic seizures have 4 phases. We have the first phase, which is the aura. The aura, could be like an emotional or sensory disturbance that is experienced by the patient before having the seizures. Okay, this is followed by an epileptic cry. Epileptic cry occurs due to the spasm of the muscles of the diaphragm, which results in a sudden shout called the epileptic cry. A tonic phase, it's a generalized spasms of the muscles. Okay. Respiratory might cease due to the spasms of the muscle. Okay, the eye pupils dilated and rolled upward. This is followed by a clonic phase when there is involuntary movement of the hands and limbs and sometimes urinary incontinence. Following those phases, the patients usually fall asleep until they can regain their full consciousness. We have the oral manifestations of patients who have epilepsy. Patients might sustain dental injuries, for example, as we can see here, this is 2 central incisors due to trauma during the seizure. Soft tissue laceration, as you can see here within the lower lips. Patients might bite on their soft tissue, tongue, lips, buccal mucosa. Sometimes the patient during the seizures might hit themselves with something and get some soft tissue lacerations. Gingival hyperplasia. Gingiva can become hyperplastic, especially with phenytoin. Okay, and this is a phenytoin-associated gingival hyperplasia. Oral ulceration or glossitis. Gingival bleeding can occur from certain medication, for example, valproate or valproic acid. And from the seizure, sometimes the patient might have the temporomandibular joint get dislocated, which requires repositioning. How we can manage patients who are epileptic patients in our dental clinic? In the first appointment, we need to take a history from the patient to establish the types of the seizure, and also we need to establish the degree of control, whether it is poorly controlled or well controlled. A well-controlled seizure patients, epileptic patients, well controlled, can have dental interventions without any precautions, while a poorly controlled patient, no, this is a different story. We need to refer them to their physician. The physician might advise change with their regime of the medication, might advise an extra anticonvulsant or an extra medications to be taken, sedative medication prior to the dental treatment. Pain control, patients can take local anesthesia, safe to use local anesthesia in patients who are epileptic. For example, lidocaine with the epinephrine. It's okay to be used with patients who are epileptic. Sometimes we use IV sedation. This would make it extra safe for them, because medication that we use for the IV sedation is also medication that's prevented development of seizures. Sometimes we have drug interactions between anti-epileptic medication and drugs we use in dentistry. For example, we have the antifungals meconazole. It's increased the plasma level of phenytoin, therefore their concomitant administration needs to be avoided. We also have antibacterial medication, for example, metronidazole. Metronidazole also inhibits the metabolism of the phenytoin and subsequently increases their plasma level. Therefore, also their concomitant administration needs to avoid it. Analgesics, we have an interaction between phenytoin and paracetamol. Phenytoin can increase the metabolism of paracetamol, which might give a risk for hepatotoxicity. We also have the valproic acid taken by patients who are epileptic, which can cause platelet dysfunction. If the patients took an aspirin, for example, or non-steroidal anti-inflammatory drug like an ibuprofen, this can further potentiate the platelet dysfunction that can occur by valproic acid and increasing the bleeding tendency. What can we do if the patient develops a seizure in the dental office? What is the emergency management of seizure in dental office? If during the dental procedure we have a seizure, we need to stop the treatment immediately. Having stopped the treatment, the treatment being stopped, we need to remove all the instruments from the patient's mouth and from around the patient. We need to adjust the dental chair to make the backrest in supine position and make it supported. So it's a supported supine position. We support the dental chair with the dentist stool. So as we can see here, the dental chair backrest is being in the supine position, and we have the headrest being supported by the dentist stool. Having changing the backrest, we also need to change the height of the dental chair. If the patient accidentally falls from the dental chair, we need to make the dental chair as lowest as possible to prevent injuries to the patient. So we need to adjust the height as well as the backrest. Restraining the patient, we don't need to restrain the patients, so no active restraining, but we need to provide a little bit of passive restraining just to prevent the patient injuring themselves. For example, hitting the spit-on or something like that, so we need to allow a passive restraining, that's fine, but no active restraining. We don't insert anything within the patient's mouth during the seizure. If we have used the mouth probe prior to the seizure, that's fine, but if we haven't used it, okay, and the patient had the seizure, we don't try to insert anything within the oral cavity, because this might increase the chance we injure the patient's soft tissue or dentition by trying to insert something, and the operator might have injuries to their fingers. After the seizures have finished, okay, we need to administer oxygen to the patients, and we need to lie them on their side, okay, to maintain their airway. Just in case the patient vomits, we don't want this vomit to block the airway. We also need to provide aspiration or suction, we need to provide suction just to clear the airway. Glucose level needs to be measured, and if the patients turn to be hypoglycemic, glucose needs to be administered. Hypoglycemia might be manifested as a seizure, so we need to administrate glucose if the patient is hypoglycemic. If the patient sustained any injury, we need to examine it both intraorally and extraorally and manage it accordingly. If the seizures continues for more than 5 minutes, or as we said, frequently repeated, this might be a status epilepticus. Status epilepticus would require administration of medication. The most common medication we would use is a buccal or intranasal 10 milligrams of midazolam. Also, we can use IV or IM 10 milligrams diazepam, IM or IV 5 milligrams midazolam. But the most instance and the emergency medication for treatment of epilepsy is the midazolam as a buccal infiltration. Oxygen also needs to be administered. If the seizure continues for more than 15 minutes, we then need to transfer the patient for hospital for emergency management. Okay, this is all what we have for the epilepsy. So for today's next part of today's lecture is the patient's dental management for patients having stroke or what we call cerebrovascular accident. What is cerebrovascular accident? Cerebrovascular accident is an acute brain damage that can be occurred due to either brain infarction or cerebral hemorrhage. Infarction can be caused by either by cerebral embolism or a distant embolism that is traveled through the circulation to reside within the brain. On the other hand, cerebral hemorrhage can also exert pressure on the brain with resultant brain damage. This all can result in neurological symptoms. If it is resolved within less than 24 hours, it is referred as transient ischemic attack. What are the risk factors for patients to develop stroke? We have patients who are having uncontrolled hypertension, atrial fibrillation. If the patient has a previous stroke, he is at an increased risk for having a new one or having a transient ischemic attack. Heavy smoking, elevated blood cholesterol level, and an extreme of age. So patients who are deemed to be more than 75 years old are at increased risk for development of stroke. What are the signs of symptoms of patients having stroke? It's really important to recognize these as the patient's prognosis would depend about the early diagnosis and the start of the treatment. If the patients are having stroke, they usually having 4 phases. From the initiation till the establishment of a stroke. This includes a transient ischemic attack. A transient ischemic attack having the sign and symptom of stroke, but it is of short duration. Patients might have face weakness, facial expression being weakened on one side of the face, like for example dropping of the mouth corner, dropping of the eyelids. Patients might have their arms being weakened on one side of the face. Speech might get disturbed. So there is a tool that is called FAST to allow early recognition of stroke, to allow time to be taken. So FAST from face, arm, speech, and time, as the time is really important or crucial for this patient. If the signs and symptoms are beyond 24 hours, is called reversible ischemic neurological deficit. Okay? Following that, the stroke is become in evolution and the sign and symptom become increased with time, and then the patient will have a completed stroke. So what are the oral manifestations of the patient having stroke? If the patient having had a stroke, they have a difficulty in speech, they have a dropping of their mouth corner, and the tongue tends to deviate laterally when the patient try to protrude it. There is also unilateral loss of sensation on the part of the oral tissues, and the oral hygiene might be difficult on that side. And since the food gets accumulated, the patients might have severe periodontal disease with bone loss. how we can manage patients having stroke. We need to establish an effective communication with our patients, especially patients with stroke. This can include an eye-to-eye contact with the patient using a simple language with a normal tone. Sometimes we need to take the mask off during the communication, and sometimes we need to use sketches to explain the treatment procedure or the treatment plan to our patients. Patients also need to establish an effective pain control. Effective pain control can be established by using nitrous oxide inhalation sedation, with proving that we have enough oxygen during the treatment, and also we can use the local anesthesia with epinephrine, but with a maximum of 2 cartridges. Patients might have their treatment get complicated because they are on different antithrombotic medication. For patients, for example, might be on prophylactic aspirin, which might increase their bleeding tendency. So careful planning needs to be taken prior to planning of extraction. If the patient had their stroke within the last 6 months, then no elective treatment can be taken, and only emergency treatment can be taken after consultation with the physician. If the patient have a recent transient ischemic attack or reversible neurological deficit, then also no elective treatment and emergency treatment can be taken after consultation with the physician. Patients might need help when they move to the dental chair, which can be provided by the nurse. The staff are advised to move slowly around the patient just to minimize anxiety. If the patient develops signs of stroke, oxygen needs to be administered immediately, and the patients need to be transferred as soon as possible to the nearest hospital. This is all what we have for today. Thank you. And if you have any question, please leave them in the comments below.